You know how in the past, we really didn't have a lot of options for hair loss? So, about 20 years ago, I used to tell patients, there is not much to do, and I was just as sad as they were that I had no tools in my hands to actually help them. Well, that has changed completely in the past 5 to 10 years. We started to use PRP, platelet-rich plasma injections for someone who has hereditary hair loss. And that actually has revolutionized treatment for hair loss. Now, of course, I would recommend to have a full workup because hair loss can be caused by so many things. We would actually do a full workup, including a blood test and sometimes even a scalp biopsy to fully investigate hair loss before we would do any treatments. Because once we know what the cause of hair loss, then we can exactly treat the cause. Now, a lot of times it is going to be genetic, which is sad news for so many. And it is a very high percentage, both in men and women. So for them, PRP injections are absolutely great solution. However, I will tell you a caveat. It can be sometimes very sensitive, a little bit painful to the scalp. Now, I have patients who actually tolerate it. They don't even flinch while they're sitting in the chair, and they love the results. Now, for people who actually don't like injections, good news, for the past couple of years, actually, there was a new laser developed that can be used for scalp hair rejuvenation. And I wouldn't tell you if I haven't seen it with my own eyes that it actually does work. What the laser does, this is actually a thulium laser. Lutronic Ultra is the best example for this. It's a thulium laser that creates these openings in the scalp, microscopic, mind you, so you will not have holes on your scalp, but these microscopic openings will allow these rejuvenating, regenerating skin liquids to be applied on the scalp, and that will absorb 5 to 6 times higher than it would without these openings on the scalp. That will go right to the root of the hair follicles, and it will stimulate these hair follicles to generate more hair. I think it's really important. Research shows that you have to start this rejuvenating treatment within 5-6 years of the hair loss starting. If you wait too long, those hair follicles will not be able to be rejuvenated. So it is really important that as soon as you notice it, seek advice, seek a consultation so we can do the workup and then do the most appropriate treatment at that point. We can rejuvenate these hairs, we can regenerate hair growth, but it needs to be timely. So don't forget, seek advice soon and find the right experts.